My name is Dr. Xuan Liu. I am a fellowship-trained breast surgeon. I went to Tufts University for my medical degree. I subsequently went to the University of Connecticut for my general surgery training. And following my interest in breast surgery, I went to New York University Langone Medical Center for my breast surgery fellowship. Breast cancer is one of the most common cancer in the United States. About 1 in every 8 women will have a breast cancer in her lifetime. So that's 12% of American women. There are many different things that contribute to a patient developing a breast cancer and contribute to increasing the risk of a particular patient to having breast cancer. Now, being a woman, that's one of the risk factors, believe it or not. It makes sense, but people don't think about it. As you age, there is also an increased risk of breast cancer. And if you think about it, as you age, your body is growing and your cells are replicating, and there's always a chance of a mutation that can cause a breast cancer. The biggest thing that people always hear about are the genetics that are involved in the causes of breast cancer, and that is completely true. There are a good number of patients out there who unfortunately carry the gene from their family, or it may be a gene that has been mutated in just that particular patient, and that increase their risk of breast cancer lifelong. I am a breast surgeon. My involvement is meeting the patient and hopefully trying to coordinate her care. Primarily, I help excise these cancer. Now, there are various types of surgeries that can be recommended depending on the patient's needs. 2 main types that I would talk about are lumpectomies and mastectomies. First, a mastectomy is basically removal of as much breast tissue as possible from that affected breast to significantly decrease the patient's risk of future breast cancer recurrence. The other surgery that we can offer a patient who comes in with a newly diagnosed breast cancer is a lumpectomy. A lumpectomy is removal of the breast cancer itself as well as a rim of normal tissue around it. So that way a patient may preserve that particular breast, but we do need to survey it over time. One of the most encouraging things that I can think of in terms of our battle against breast cancer is that the earlier we can diagnose a breast cancer, the sooner we can start on the treatment, hopefully the higher chance of the patient surviving her breast cancer.